Hi everyone, today we will start from hypothyroidism. Hypothyroidism is rare in cats. Let's have a look at hypothyroidism cat. You can see bulkiness in cat. So definition, hypothyroidism is inadequate production of the thyroxine T4 and triiodothyronine T3 in body. It is generally characterized by the decrease in cellular metabolic activity. Okay. If we talk about pathophysiology, it may be primary, secondary, or tertiary hypothyroidism. Primary hypothyroidism is due to the defect in the thyroid gland. Whenever there is a defect, destruction, atrophy in the thyroid gland, then it is primary hypothyroidism. Primary hypothyroidism may be due to the lymphocytic thyroiditis mediated process characterized by the chronic and progressive lymphocytic infiltration. This is an immune mediated process. Then primary hypothyroidism may be due to the idiopathic thyroid atrophy. Both these lymphocytic thyroiditis and idiopathic thyroid atrophy together count for 95% clinical cases of the hypothyroidism. Secondary acquired hypothyroidism is rare. It may be due to the defect in the pituitary gland. This one is due to the defect in the thyroid gland. This is due to the defect in the pituitary gland. And the tertiary hypothyroidism not reported is due to the hypothalamic defect. Okay. So let's have goiter. Enlargement of the thyroid gland develops when there is an increased release of TSH, thyroid stimulating hormone, along with an intact thyroid TSH receptor. The system which are affected, like these are systems, will be covered in the signs and symptoms. When you genetics basis, incident prevalence, primary hypothyroidism is the most common endocrinopathy in the dogs. It is rare in cats, but most common in dog. Hypothyroidism is rare in cat, then species dog mostly, and rarely cats. Breed large breed dogs are most common. Historical finding, we see weight gain and hair loss. This is, you can say, clinical finding or symptom. Clinical finding you can differentiate from other disease, just like a tentative diagnosis. Weight gain and hair loss, you can see in picture like that. Heavy weight gain, then pyoderma, hyperpigmentation of the skin. Okay. Then physical exam, you find dermatological abnormality, bilateral symmetrical non-periodic truncal alopecia. You find truncal alopecia in hypothyroidism. Then seborrhea is common, otitis externa, weight gain, decreased activity and lethargy. You can say weight gain is also a prominent sign. Next, there is also a you can say disease which is termed as congenital hypothyroidism, most common in the kittens. Lethargy, dwarfism, alopecia. Cause are we discuss in the pathophysiology, that lymphocytic thyroiditis, idiopathic pituitary disease, iodine deficiency. Risk factor are surgical removal of the thyroid gland, then 1,3 iodine, 131 isotope, overdosing for the treatment of the hypothyroidism. We differentiate it from the primary dermatological disease. Other about you see TSH stimulation test is the gold standard test for the hypothyroidism judgment. Total T4 initial screening high sensitive test for the thyroid function. This test measure both protein bound and the free T level. This is the initial high sensitivity test. Then free T4, you can also do free T4 test, which measure the hypothyroid animals would be expected to have a low free T4 levels. Then endogenous TS level is expected to be elevated in the primary hypothyroid due to the loss of the negative feedback. TS stimulation and consider the gold standard. You also know that this is a gold standard test for the hyper. This is also very important thing about the NAVLE exam. There are other factors which are non-thyroid factors that alter thyroid function test. You see low level of T3, T4, but there is an you can say there is a normal thyroid gland, but you see low T4 and T3 due to the maybe due to the sick euthyroid syndrome thyroid function test. Okay, then you can see in stress condition some dogs show in stress condition they lower the T43 level. Then sulfonamides, gluco glucocorticoids, phenobarbital, these are the drugs which lowers the T43 level, but the thyroid gland remain the normal. So these things can alter the results of the laboratory. Then imaging, we see developmental bone problems in the congenital hypothyroidism. If we go about ultrasonic findings, then there is no significant difference in euthyroid and sick euthyroid subject. Lifelong therapy required for the treatment of the hypothyroidism. Drug of choice is synthetic thyroid hormone supplement. It is a drug of choice, and the one other thing is levothyroxine sodium. These both are the drug of choice for the hypothyroidism: synthetic thyroid hormone supplement and levothyroxine sodium. If there is a do not presence of, if the T4 level do not normalize after attempting monitoring and treatment, then we go for leothyronine, which is a stronger one than levothyroxine. Then patient monitoring, you do total T4 levels. So blood is taken 4 to 6 hours after pill administration. Hypothyroid animals, if not treated, complicated into myxedema, coma, and atherosclerosis. Primary, if you talk about prognosis, primary hypothyroidism can easily and successfully control the prognosis for affected animals when appropriate treatment is excellent. If treatment is properly done, congenital hypothyroidism has a guarded to poor prognosis. So that's all about the hypothyroidism. If you have any question or you want to ask anything, you can ask in comment section, or you can ask to our WhatsApp number. Thank you. Have a good day. Meet you in the next video.